More than a decade after Andrew Sullivan declared the end of AIDS on the cover of the New York Times Magazine, Black and Latino communities in the U.S. continue to be devastated by the disease. Our first story explores the efforts underway to fight this largely invisible crisis, a crisis in which race, class, and poverty combine to hinder HIV prevention and treatment.
You know, as HIV and AIDS has changed from being a white, gay, male, middle and upper middle class disease to a disease of people of color, it has disappeared from the front pages of many publications.
When we talk about HIV and AIDS in the Latino community, people say, well, that's a problem of Africa, because that's what we all have been told.
If Black America were a country unto itself, it would have an epidemic that outstrips the epidemic in Ethiopia, Namibia, Botswana, Haiti, Cuba. When you look at Black gay men, you have an epidemic that outstrips any place else on the planet.
There's over 100,000 people in New York City living with HIV and AIDS. The numbers in the 13 to 29-year-old age group has been going up with men who have sex with men. In the Black and Latino community makes up 80% of that number.
The AIDS epidemic in Black communities now exists for a whole host of reasons. One is the way the virus works. And because Black communities were slow to respond to the AIDS epidemic in the beginning, because the AIDS epidemic was mischaracterized as a white gay disease. And so, quite frankly, it's kind of the old phrase, while you were sleeping. While we weren't paying attention, the virus had a chance to take a hold in our communities. That means that in Black gay context, nearly 1 out of 2 sexual encounters, you're likely to encounter HIV.
In the Black community, there is a lot of denial. People just don't think they're at risk. In spite of everything that's gone on, people don't feel at risk. When one talks about HIV as being a chronic disease but not fatal, that's half of the story, because HIV is a chronic disease in many instances, but it's also fatal in many instances. The concept on the street that it's a chronic disease, oh, I can take 1 pill a day. You know, there's this commercial that says 1 pill a day you can stay on top of your HIV.
The fact that actually many ads coming from pharmaceutical companies are showing us all these beautiful, hunky, young men, ready to take over the world, is really not helping. And what I'm saying is, we don't have a balance between scaring people about HIV and telling them HIV is not a problem.
Today I would like to share with you a story about my AIDS. I'm just about hitting 30 and I feel and look fantastic. My AIDS pills have been keeping me embalmed for some time now. On the outside anyways. I believe I've shit out my spleen last week and my liver is surely next to go. We'll go for a walk. I decided I would use comedy to talk about my personal stories in dealing with whether it's being gay or HIV or homeless. I was definitely a welfare baby. So I'm no stranger to food stamps or government checks.
A lot of the factors that are driving the epidemic are issues of poverty and lack of access to health care.
In Los Angeles, where I live, emergency rooms are being closed. Entire hospitals serving, Black and brown communities are being closed. So people don't have the same level of access to care and treatment. There's the issue around HIV science literacy. Now, often in poor communities and people of color communities, people don't understand the science of HIV. And when you don't understand the science of HIV, you're less able to protect yourself from the virus and infection.
my family, they are from a small town in Virginia. And there's not very much exposure to HIV, or if there is, no one's really talking about it. So I've lost a lot of family members that I thought were really close to me. When I told them that I was positive, a lot of them kind of took a major step back, and just since June of 2005, I've been out of communication with them.
It's very obvious that we have not done a good job as a people. We have not done a good job as a church. We have not done a good job as a family in dealing with whether HIV and sexuality.
When you add the burden of homophobia to that context, once you are either removed or isolated from your community and your social networks, be it family, larger community structures, the church, given disproportionate levels of poverty and unemployment, what do you have to fall back on?
Homosexuality in the Black church is a major sin. Many people who found themselves gravely ill also came out. They used that time to talk about their sexuality. So the focus became the sexuality versus the human suffering of the disease. So Unity filled a gap in that way. Unity Fellowship began to look closely at the theology of mainstream churches, and we begin to challenge some of those ideas.
We thank you, dear God, for a place where we can come as one people, black and white, straight and gay, all together in one place, on one accord, for one reason. We don't take it for granted. We don't take it lightly.
In the Latino community, certainly, we still struggle about talking in terms of sexuality and sexual health. It comes with a number of issues: homophobia, the lack of opportunity to talk about sexual orientation, stigma, and we immediately try to make a moral judgment.
All of these social factors that has to do with people's behaviors that often show that they don't have any hope for the future. So if you don't have any hope for the future, you don't pay much attention to what you do today that impacts your future.
Taking the test a lot, and I've always come here, and I guess church is the safest place for me, and I feel more comfortable at church by taking it, and I'm glad that my church actually does provide it.
Would you like you're going to take the test?
When people don't feel safe, they are less likely to disclose their risk factors, and they're less likely to seek care and treatment.
What do you expect your results to be today? Positive, negative, or not sure?
Honestly, not sure.
If you were tested for HIV, what would you do?
From that point on, I would make sure I have to take care of myself better.
Would you seek a physician?
Yeah, that's what I need to do, is seek coverage for a doctor.
You should take that.
In New York City, almost 1,000 people a year get tested for HIV, have already advanced to AIDS. That means for 8 to 10 years, they have been usually unknowingly transmitting the infection to other people.
Right there? Yeah. When I moved here, one of the churches was having an outreach, and during their outreach, Justin showed up. It was difficult for me to see an 18-year-old in the condition that Justin was in. Justin was with me until he got his health back, and to see as many young people who are continuously getting infected, they need guidance, they need to be empowered to learn how to live, and that becomes my role for Justin, that you can survive with HIV, not just survive, but you can live, be prosperous and productive, within your community.
We have no national strategy, coordinated plan to deal with, HIV, either prevention, testing, or care.
What we have is, quite frankly, a collection of uncoordinated programs that work in silos onto themselves.
Darren, your test came back negative, which is a good thing. So since it's negative, try to keep it negative.
It's very important to make HIV and AIDS, to integrate it into the fabric of healthcare in general, in community-based programs in general, in faith-based programs in general, and not to separate it out. The longer we separate it out, the more it's stigmatized. And we need to work to destigmatizing.
We need to develop a national AIDS strategy with integrated programs with specific goals and objectives where people are held accountable along the way. That certainly is the only way that we're going to end the AIDS epidemic in the United States writ large, and is also the only way that we're going to end the AIDS epidemic in Black America.